Greetings to all our viewers. Welcome back to yet another illuminating session of PhysioTV. I am Dr. Mudita Chavan. I am an assistant professor in the Kinesiology and Kinesiotherapy department at Sancheti Institute for Orthopaedics and Rehabilitation College of Physiotherapy, Pune. Physiotherapy is undoubtedly a vital profession within our healthcare system. Even so, there exist a multitude of alternative career paths that one can seek if they are wanting to expand their horizons beyond the traditional scope that physiotherapy has to offer. On that note, I want to introduce you all to our invited guest speaker today, Dr. Juwayriah Dalvi, who has already taken a step to venture onto this road less traveled. Dr. Juwayriah works as a consultant physiotherapist and as a medical advisor at Abbott India Limited. She is an alumna of the Topiwala National Medical College, Mumbai, and she has completed her master's in cardiovascular and pulmonary physiotherapy from Lokmanya Tilak Medical College, Sion, Mumbai. She has been an active member of Switch India and being a keen having keen interest in the field of research and looking into the current developments in the field of physiotherapy, Dr. Juwayriah has also contributed to and written many multiple articles for the PhysioZest, which is an online e-magazine on physiotherapy. Apart from this, she also has a creative side to her, indulging in poetry writing and also performing on stage, presenting her poetry to the audience. She also has her own blog and she absolutely loves writing. With that, I am delighted to welcome Dr. Juwayriah Dalvi on board once again. Over to you, Dr. Juwayriah.
Thank you so much, Dr. Mudita. Thank you for this wonderful introduction. So I'm really glad to share whatever little experience that I have gained in a small period of time in alternating paths to physiotherapy, as she said, a road less traveled by. So I think doing new things has been something that has always attracted me. And while I was studying also, in PG days, I was exploring different clinical avenues in the college, in the ICUs, outside college, while going for field visits or exploring observerships, seeing around patients with different set of people, experiences, sharing seniors' experiences. Immediately after the PG phase ended, I also worked in a clinic which was newly founded. So I tried to explore how a new clinic works, how build something from scratch. And at the same time, I was also listening to different kind of opportunities, listening about different kind of opportunities which exist for medicos, not just physios, but medicos in general in the corporate sector. So that was again something which was very fascinating. I would say my inspiration was a friend of mine who had finished her BDS, and instead of pursuing masters immediately, she went on to explore corporate journey. And from she was the source of knowledge for me first, that I came to know that okay, even medicos can go into a corporate world if they want to. And I that was an example which was set for me. So today, when I also can share this experience and extend that experience to the physiotherapy community, I'm very happy to do so. Um, Firstly, I would like to say that our profession is a noble profession, and there's no doubt about it. Whenever we are newbies in the career, we start having doubts, we start facing too many challenges, we start understanding the realities of making a living. But I think that's something which is common to everyone, and everyone faces those things no matter which field you are in. So it's so exploring alternate career paths does not mean that you should get demotivated from your own profession. It's just an extended horizon and extended vision to look at your own skill set and your talents, and see what else they can do. So it's more of exploring journey, and after that you can definitely take a call whether you want to continue in the corporate world, you want to explore the clinical side, and those decisions come in slowly. But it nowhere means that our profession lacks any kind of spirit or the success factor. So there is it's a skill that we must all value a lot. And with that note, I would then shift to explain how a corporate setting works and how what kind of opportunities are present in the corporate world. So, if you see corporates, they work in industries. So there are few industries which uh, are related to healthcare. First is pharmaceutical industry. Second is hospital industry, and the third one is fitness industry. These three industries are the key industries in healthcare sector. And out of those three, I have gone forward with a pharmaceutical line. However, the opportunities lie in all these three industries. So even in hospital setting, there are administrative roles, there are corporate roles which require a medical know-how, but the job description is not necessarily clinical based. So I think MHA, everyone is aware of MHA, which is a management in healthcare administration, masters in healthcare administration, which MUHS offers. It's a course, and a lot of our colleagues have pursued that course. So it's something that is well known. However, there are certain things which are not as well known when it comes to corporate industry. So then coming to the pharmaceuticals, in pharmaceuticals, there is a lot of exposure for medicos in terms of medical writing, in terms of pharmacovigilance, in terms of medical advisor, and also in clinical research. So there are certain courses which MUHS also offers, which can help in it's again a master's program, which can help you in pharmaceutical industry. I so it's a small master's program and diploma program. I am not sure of the exact title of that course, but it is there in MUHS itself. Other than that, also, even with your general master's degree, you have a certain medical knowledge, certain medical know-how, which can help you excel in these fields. Although it's an horizon which is not not everyone's cup of tea or everyone's liking, because we spend so many years in the clinical setting. So some of us are still inclined to some administrative kind of work. We like to be creative. We like to do desk research or generate systematic review articles, write manuscripts. For us, for some of us who like these kind of things, corporate industry offers a lot of avenues. At the same time, switching to a completely different role, which is not related to healthcare, is also an option, especially in pharmaceuticals and agencies which help the pharmaceuticals. So it's a wide range of organizations which work in this industry. And these agencies, again, they require people who are from medical background, who can understand what kind of work is going on in the organization, and then they can help in different ways using their medical knowledge and skill. They can help in research. They can help in writing medical content, writing scientific literature. They can help in conducting clinical studies, researches, understanding those, making those research documents, driving those initiatives which are medically oriented and which are required in the industry. So this is the gist of the work which is present for medicos in corporate. Then comes the fitness industry. So again, fitness industry can be divided into on-field and corporate both. So on-field industry is when you're on the ground. So I think most physios are aware of fitness industry on field when we work with different organizations such as I would actually refrain from naming any organization, but you work for organizations which help in diet and cosmetic counseling or takeovers, and diet, combination of diet, exercises, and that kind of therapies. Then there are industries which have chains of spa and physiotherapy combinations. So these are again a corporate kind of industries where you have two sets of roles. One is a clinical role, and another will be a managerial or a corporate role, where your roles will be defined, but you will be required to know the medical aspects of things. So that's what they say. Even to run anything which is related to healthcare, you need to have certain knowledge. Need to have a background to understand the day-to-day operations, the logistics, the content which is required in the industry. So that is how a lot of avenues are open for physiotherapists, for medicos in corporate world. And then again, it's not like it's a 100% success ratio that okay, I'll just go and get into any corporate and I'll be successful. The same kind of struggles exist everywhere, whether it is physiotherapy, whether it is an alternating path to physiotherapy. There is going to be the same ratio of effort and luck and struggle which we face in any setting, in any way of going forward. So it's totally your call to take that informed decision. It's something that you need to really research upon if you are thinking of an alternate career path. So as I said, there are these three industries, and there are different roles in these industries, and it's a long list, it's a vast horizon to explore. So it will require a lot of research, and I would say I myself am at a very nascent stage. So I wouldn't say that I have a lot of experience in this, or I know everything about how to be in a corporate role. But I would suggest that if you want to explore this, definitely do your research, take an informed decision, give it a try if you want, and then take a call whether your clinical side is better, or your whether your creative and research acumen, business acumen. Actually, working in industry also requires a certain kind of business acumen. But even as a physiotherapist, if you are setting up your own clinic, you need that business acumen. So it's the life outside of your academic journey is a mix of knowing different things from different fields, and then applying the best possible skills and best possible things that you are good at to take your career forward. I think this is the biggest thing that I have learned in the past year, and I'm still learning. I'm still a student. I would say we'll all remain students for the rest of our lives. But yeah, so this is about my experience as a corporate, and my understanding of the corporate world, which is very, very nascent at this moment. And there's a lot of experience and research involved, which required, which will take this forward. So thanks, Ulta. Over to you.
Wow. Thank you so much, Dr. Juwayriah. Like, I would still have a couple of questions to ask you. Like, what
Sure.
made you choose this path over something, students usually get into clinicals more, or usually they would like to get into or join a clinic or a hospital, or probably go into the
Hmm.
academic field. So what prompted you, or what maybe motivated you, or gave you that little hint that maybe I should try and explore the corporate world of it? So if you
So
could.
I was always somebody, as you mentioned, I liked writing a lot, and then we have done research together. So I have a certain bias for research work. So these two things, and when combined with medical knowledge and then application, so the theoretic application in the background that we do, that was very fascinating for me. So I thought, why not? Let's give it a try. And it really felt it worked really well for me. So I am currently in that direction. But yeah, I would say that clinical physiotherapy is a skill that nobody should ever lose. So if whatever you might be doing, you can have a patient at the end of the day, or you can go to a charitable clinic at the end of the week. But you need to be in touch with the clinical skills, because it's a gift. If we have been investing so much time in this, and we've got that gift, so not to lose it is something that I would always say.
Okay. One more thing I'd really like to know is, someone does venture into the corporate world. So how should you choose whether to get into, like, for example, you are in pharmaceuticals. So how do you choose between that, maybe a pharmaceutical company or some other stream in the corporate world? Is there, like, I know it's still the beginning for you, but still, how did you choose into that? How did you come up with that decision?
So I think it's one thing that if you want a complete switch, if you want a completely managerial or marketing role, then it becomes a totally different avenue, and you might have to pursue your MBA for going to going having a longer run in that field. But and if you are interested in management, then definitely there are those roles which are specific to management. You will, once you start looking around, digging deep, you'll find starting with agencies, pharmaceutical agencies is the key for freshers, and slowly climbing up to bigger pharmaceutical industries. And yeah, so depending on the opportunity also, actually it's also depending on the opportunity. So it depends whether a fresher role is available in a good organization, and the job description fits your idea of working in a particular field, then all three things combine and you take a call. And also, of course, the monetary benefits, the timings, the logistics, all of that, they take a they have a big role in taking that decision, selecting. If you are more of a research or a writing person, so there are medical writers, research assistants, research associates, clinical operations. So in that zone, then you communications, developing medical communications. If you are more into creativity, then you can go for these roles. And it's choosing the industry, again, it depends on your interest and the kind of opportunities which are available. So all the healthcare industry in itself is very small. If you compare it with FMCG, or if you compare it with software or IT industries, these are huge industries. In comparison to those, healthcare industries are really small. So it's easy to make a choice, and there are not too many options
This.
compared to other industries. If you see in corporate settings, so it becomes very clear. So hospital may these are the roles which I can get. Pharmaceutical may these are the roles. Agencies can help me in these roles, and then fitness industry may these are the roles. So you get a comprehensive gist in your mind, and then it becomes easy to select. And of course, you should also be selected for the opportunity. So it works kind of both ways.
Okay. Wow, that was really amazing. I uh, I personally, this was something very new to me. Like we spoke before, this is something very new to me, and also I got to learn so much that is beyond physiotherapy, not just physiotherapy, of course, but also something beyond into the healthcare system. So that was
Yeah,
really
so
great.
there's
And
one more thing I wanted to add, that it's not just physiotherapists who are looking for alternate career paths. It's filled with medical graduates, MBBS graduates, uh, MD pharmacology residents, doctors, BDS doctors. So it's not that the clinical roles don't offer enough. It's sometimes just a matter of interest. So a lot. So there also you will have the same kind of competition with the degrees and their degrees and experiences being very different from ours. So that is also one of the factors which definitely is in the picture.
wow. Thank you, Dr. Juwayriah, for sharing your personal experience with all of us. I'm very sure this experience must have been a guiding light to all of those who are hoping or looking forward to explore other parts of the healthcare system and maybe beyond physiotherapy. So, to explore those fields. So, I'm really glad you could share your side of the story with us. Also, the effort you took in explaining the intricacies and maybe help us a bit in choosing if we do want to pursue into this field. So, that thank you for those efforts, and I'm really glad you could join us for this talk and talk to us for some time out of your busy schedule. So, thank you so much for joining
Thank
us.
you, thank you, thank you for giving me this opportunity for sharing. Thank you.
I want to thank you, the Physio TV team, and also our technical team, and also the Sancheti Institute for giving us this opportunity for conducting this session. Thank you so much.